Bronchitis is an inflammation of the bronchial tubes. These tubes carry air to and from your lungs. When they're inflamed, it affects your breathing. Think of your airways like a tree. The trunk is your windpipe, and the branches are your bronchial tubes. When you have bronchitis, these branches get irritated and swollen. This swelling narrows the airways, making it harder for air to flow in and out of your lungs. It's like trying to breathe through a straw. There are two main types of bronchitis, acute and chronic. Acute bronchitis is very common. It's often called a chest cold. It usually lasts a few days to a week, but the cough can linger for several weeks. Chronic bronchitis is more serious. It's a long-term condition that comes back repeatedly. If you have chronic bronchitis, you'll have a cough and mucus most days for at least 3 months a year, for 2 years in a row. Acute bronchitis is usually caused by a virus, like the cold or flu. It's highly contagious, especially in close quarters. Chronic bronchitis is often caused by smoking. Other irritants like air pollution and dust can also play a role. You're at higher risk for bronchitis if you smoke or are exposed to second-hand smoke, have a weakened immune system, have allergies or asthma, or work in environments with fumes or dust. The main symptom of bronchitis is a cough. Other common symptoms include coughing up mucus, which may be clear, white, yellow, or green. Shortness of breath, wheezing, chest tightness, and fatigue. Section 5. Diagnosis. Determining the root of the problem. Your doctor will ask about your symptoms and medical history. They'll listen to your lungs with a stethoscope. Sometimes, further tests are needed to rule out other conditions. These tests may include a chest X-ray to check for pneumonia or other lung problems, a sputum test to examine the mucus you cough up for bacteria, and pulmonary function tests to measure how well your lungs are working. Section 6. Treatment options. Easing your bronchitis symptoms. Bronchitis can be a challenging condition to manage, but with the right approach, you can ease your symptoms and improve your quality of life. Treatment for bronchitis depends on the type you have. There are two main types, acute and chronic bronchitis. Each requires a different approach to management. Acute bronchitis usually goes away on its own within a few weeks. It's often caused by a viral infection, similar to the common cold. Treatment focuses on relieving symptoms. Rest to give your body time to heal, which is crucial for recovery. Drink plenty of water to thin the mucus, making it easier to cough up and clear from your airways. Use a cool mist humidifier or take a hot shower to add moisture to the air, which can help soothe irritated airways and loosen mucus. Over-the-counter medications like pain relievers and cough suppressants can help manage symptoms such as fever, aches, and persistent coughing. Chronic bronchitis, on the other hand, requires long-term management and is often associated with smoking or long-term exposure to irritants. Treatment may include medications like inhalers, bronchodilators, or steroids to open up your airways and reduce inflammation, making it easier to breathe. Pulmonary rehabilitation can be beneficial, as it helps improve your breathing and exercise tolerance through a combination of physical exercise, education, and support. If your oxygen levels are low, oxygen therapy may be necessary to ensure your body gets the oxygen it needs to function properly. You may need supplemental oxygen, especially during physical activity or while sleeping, to maintain adequate oxygen levels and prevent complications. Additionally, it's important to avoid smoking and exposure to secondhand smoke, as these can worsen your symptoms and overall lung health. Practicing breathing exercises and maintaining a healthy lifestyle can also contribute to better management of bronchitis symptoms. Always consult with your healthcare provider to determine the best treatment plan for your specific condition and to ensure you're taking the right steps towards recovery. Section 7. Prevention strategies. Protecting your respiratory health. Your respiratory system is vital for your overall health and well-being. Taking steps to protect it can prevent serious illnesses and improve your quality of life. Here are some ways to lower your risk of getting bronchitis. Quit smoking. Smoking damages your lungs and weakens your immune system, making you more susceptible to respiratory infections. By quitting smoking, you can significantly improve your lung function and reduce your risk of chronic bronchitis and other respiratory diseases. This is the most important thing you can do for your lung health. Get vaccinated. Vaccinations are crucial in preventing respiratory infections. They help your body build immunity against harmful viruses and bacteria. Get your flu shot every year and talk to your doctor about the pneumonia vaccine. These vaccines are especially important for older adults, young children, and individuals with chronic health conditions. Wash your hands often. Use soap and water or an alcohol-based hand sanitizer. Proper hand hygiene is one of the simplest yet most effective ways to prevent the spread of respiratory infections. Make sure to wash your hands for at least 20 seconds, especially after coughing, sneezing, or being in public places. Avoid close contact with sick people. Respiratory infections can spread easily through close contact. By maintaining a safe distance from those who are sick, you can reduce your risk of catching their illness. If you're sick, stay home to avoid spreading germs. Wear a mask. Staying home when you're unwell helps protect others from getting sick. Wearing a mask can also prevent the spread of germs, especially if you need to be around others. In crowded places or during cold and flu season, wearing a mask can help reduce your risk of infection. Masks act as a barrier, preventing respiratory droplets from reaching others and reducing your exposure to airborne pathogens. By following these strategies, you can protect your respiratory health and contribute to a healthier community. Section 8. Potential complications. Understanding the risks. When dealing with bronchitis, it's crucial to be aware of the potential risks and complications that can arise if the condition is not managed properly. Bronchitis can sometimes lead to complications, especially if it's not treated properly. Possible complications include pneumonia. Pneumonia is an infection of the lungs that can be serious, especially in older adults and people with weakened immune systems. It can cause severe illness and even be life-threatening if not addressed promptly. An infection of the lungs that can be serious, especially in older adults and people with weakened immune systems. Symptoms can include high fever, chills, and difficulty breathing, requiring immediate medical attention. Chronic obstructive pulmonary disease, or COPD. COPD is a group of lung diseases that make it difficult to breathe. It includes conditions like emphysema and chronic bronchitis, which can cause long-term breathing problems and significantly impact quality of life. A group of lung diseases that make it difficult to breathe. Patients with COPD often experience shortness of breath, chronic cough, and frequent respiratory infections. Chronic bronchitis is a type of COPD. Respiratory failure. chronic bronchitis involves long-term inflammation of the airways, leading to persistent cough and mucus production. Over time, this can result in respiratory failure. This is a serious condition that occurs when your lungs can't get enough oxygen into your blood. Respiratory failure requires immediate medical intervention and can be life-threatening if not treated promptly. Understanding these risks can help in taking preventive measures and seeking timely medical care. Section 9. Seeking medical care. Knowing when to consult a doctor. See your doctor if your cough lasts more than 3 weeks, you have a high fever over 100.4 degrees Fahrenheit or 38 degrees Celsius, you cough up blood or thick green mucus, you have difficulty breathing or shortness of breath, you have wheezing or chest pain. Section 10. Key takeaways. Your guide to bronchitis management. Bronchitis is a common respiratory condition that causes inflammation of the bronchial tubes. Understanding the different types, causes, symptoms, and treatment options is crucial for effectively managing this condition. By taking preventive measures, such as quitting smoking and getting vaccinated, you can significantly reduce your risk of developing bronchitis. If you experience any persistent or concerning symptoms, it's essential to seek prompt medical attention for proper diagnosis and care.